I've worked at the other two major teaching hospitals in Vancouver, and for me, working at St. Paul's, I was the happiest here.
I've worked with Dr. Corral for about 10 years now, and in the past 4 years, I have watched her really rise to the occasion. Our department went through a very difficult time where the head of our department became ill and stepped down, and Dr. Corral courageously stepped up to that position, not really expecting that she was going to become the new head of a department.
The staff, not only in the department but in the program, we share certain values that I've heard many other people say they recognize as soon as they come to St. Paul's. And for me, again, they resonate with me personally. So I have always felt that this was the place where I fit best. It has been a very challenging year for a number of reasons, but including the high-profile cases that were featured in the media. And our staff really did have a very difficult time.
Our next story is about British Columbia's only eating disorder treatment program for adults and allegations it's turning away critically ill patients.
We are all concerned when we hear that our patients are suffering. However, I can only reiterate that we have very stringent and evidence-based criteria with which we make these decisions.
Last February, a 71-year-old man was stabbed in the chest, attacked in a Vancouver coffee shop by a complete stranger. Now a review triggered by the incident has led to the release of this lengthy report. While the report doesn't find specific blame, it notes the cases St. Paul's faces are often complex.
We've seen a 43% increase in the number of patients that present to St. Paul's emerge with mental health concerns over the last few years.
Every year, St. Paul's Hospital treats thousands of patients who are mentally ill. But it's the case of Nicholas Osute that prompted hospital administrators to order an internal review. 2 days after seeing a psychiatrist at St. Paul's, police say he randomly beat up 3 women in Vancouver. Today, the results of the hospital review were revealed.
We did a very good job of delivering clinical care, and all of the clinical processes were sound. When we conduct internal reviews in cases where there is serious harm, for example, we do that with a no fault or no blame outlook.
I think that that this award very much encompasses her character. She always makes decisions based on what's the best, what's the right thing to do. It may not be the easiest thing to do, but it's always from a firm grounding of what is best for patients, what is best for the community at large.
I think when the nomination came out and I seen it, Maria's name just popped into my head immediately. She's just somebody that in our program has always driven very positive change and is probably one of the most collaborative physician leads I've ever worked with.
We've had huge increases in volume that no one would have predicted in the last several years. So again, it was reassuring for us to know that we have been doing really, really well.
She is compassionate. She conducts herself with integrity. She is kind. She is a great physician. She is a very, very good leader. She is transparent.
I was prepared to take on the leadership position, and there's no question that, I would say it's probably the most difficult job I've ever had. But I couldn't have done it without the support of the people that work with me.